These are the cases you absolutely want to know about if you're currently taking or thinking about taking peptides. We are talking about a documented case of a 39-year-old male who ended up in the intensive care unit with severe muscle breakdown and a heart rate of over 140 beats per minute after a single peptide injection. We're talking about a 45-year-old left with permanent kidney damage, a 22-hour urological emergency that required immediate needles to decompress the tissue, and a multi billion dollar global black market currently collapsing under a wave of armed federal raids, international indictments, and sudden shutdowns. This isn't social media hype. This is the raw data from the clinical cases and federal courts over the last several years. And you need to know what is actually inside these vials before you pull the plunger. Now, before we look at the clinical cases, let's establish something very important. Peptides are not inherently evil, they're not bad. This is not about sounding a sensationalist alarm. Peptides represent a massive, legitimate frontier in endocrine medicine and tissue repair. When synthetic peptides are developed, manufactured, and administered under rigorous FDA approved pharmaceutical guidelines, they can be life changing. Look at GLP-1 receptor agonists for metabolic health, for example, or compounds like bremelanotide, which is successfully FDA approved under strict clinical guidelines to treat specific conditions like hypoactive sexual desire disorder. These molecules have profound biological potential and use, but like any highly active medical substance, their power means they do not come without risk. They must be treated with caution and they require professional medical supervision. The problem we're facing today isn't the molecule itself, it's where they are coming from, how they're being manufactured, and the widespread misunderstanding surrounding their dosages and their use. To understand how we reach a point where patients are ending up in the ICU, we have to look at the regulatory landscape. Historically, many anti aging and wellness clinics relied on state licensed compounding pharmacies to formulate custom peptide blends. To govern this, the FDA used the Section 503A Bulk Drug Substances List. Category 1 contains substances safe and eligible for compounding. Category 2 designates molecules that present potential safety risks, making them ineligible for routine clinical compounding. In the late 2023, the FDA officially moved several of the most popular wellness peptides, including BPC 157, Ipamorelin, and Melanotan II, into Category 2. This effectively halted their legal manufacturing and distribution by legitimate audited US compounding pharmacies. But instead of stopping consumer demand, this restriction created a massive, dangerous feedback loop, bypassing the law. A massive online gray market exploded. Websites and unregulated clinics started selling these high potency injectables under the deliberate legal shield of for research purpose only, or not for human consumption, while quietly packaging them with injection supplies and dosing instructions as though they were coming from a physician. When you purchase a vial from an unregulated online research chemical vendor, you are stepping out of the pharmaceutical supply chain entirely. To quantify this risk, a specialized peptide testing lab in Texas analyzed thousands of gray market peptide products over a 14-month period. Their findings were staggering. Approximately one third of all the peptide products tested failed basic checks for quality, purity, or advertised concentration. Furthermore, because these backyard laboratories lack standardized stabilization and filtration protocols, these vials frequently contain structural impurities, aggregate proteins, and dangerous endotoxins. When injected, these endotoxins can trigger severe localized tissue necrosis, systemic inflammatory cascade, or life threatening anaphylactoid shocks. But let's say the peptide you bought is pure. You are still facing the second half of this crisis: manual dosing math and injection technique. With the massive shortages of commercial standardized pre-filled single-use pens for GLP-1 receptor agonists like semaglutide and tirzepatide, consumers flooded towards compounded versions. Commercial pens are non modifiable. You click a button and you receive the exact dose. Compounded variants, on the other side, arrive in multi dose glass vials, and the patient is required or expected to manually calculate, convert, and extract the liquid using a separate syringe. The FDA has been receiving hundreds of adverse event reports detailing severe hospitalizations caused entirely by simple syringe confusion. Many people try to avoid or completely ignore the facts. The vast majority of these involve patients accidentally giving themselves a massive 5 or 20-fold overdose. Just think about the math. A patient is prescribed a tiny 5-unit initiation dose, representing just zero point zero 0.05 cc's of fluid, but they're handed a standard 100-unit insulin syringe. Unfamiliar with medical units, the patient draws the fluid all the way up to the 50 units mark instead of the 5 units line, injecting a massive 10-fold overdose. And it isn't just patients. Healthcare providers themselves are routinely failing to navigate the complex mathematics of compounding concentrations. It is not an easy task. Because every unregulated clinic or compounding source uses vastly different milligrams per milliliter concentrations, clinicians make incorrect volumetric conversions. In one documented case, a clinician intending to prescribe a standard starting dose of 0.25 milligrams of a peptide accidentally wrote the order for 25 units, exposing 3 separate patients to immediate massive overdoses that cause unrelated projectile vomiting and profound acute dehydration. When these overdoses or unverified compounds enter the human body, the clinical results can be catastrophic. Let's walk through the actual peer reviewed case reports. First is the Melanotan II toxidrome. Melanotan II is a synthetic, non selective melanocortin receptor agonist designed to bind to type 1 receptors to stimulate skin pigmentation. But because it is completely non selective, it also acts as a powerful agonist at central and peripheral type 3 and type 4 melanocortin receptors, which directly control your sympathetic nervous system, cardiovascular reflexes, and erectile pathways. In a case report published in peer reviewed clinical literature, a 39-year-old Caucasian male arrived at an emergency department 2 hours after self injecting a 6 milligram dose of internet sourced Melanotan II, a massive dose estimated to be 6 times the standard initiating protocol. He presented with acute sympathomimetic excess, severe anxiety, diffuse muscle tremors and aches, profuse sweating, dilated pupils, a blood pressure soaring over 150, and a heart rate peaking at a dangerous 140 beats per minute. When the lab came back, it revealed profound systemic muscle tissue destruction and severe renal strain. His initial creatinine phosphokinase or CPK level, which measures muscle breakdown products in the bloodstream, was highly elevated and rapidly exploded to a life threatening peak within 12 hours. His muscle tissue was literally dissolving into his bloodstream, threatening to freeze and destroy his kidneys. He required immediate admission to the ICU and aggressive IV fluid resuscitation laced with sodium bicarbonate to try to alkalinize his urine and prevent acute tubular necrosis, which can be a catastrophic event. But the vasoconstrictive properties of central melanocortin stimulation don't stop at rhabdomyolysis. In another prominent case, a 45-year-old male with a 6-month history of intensive Melanotan II use presented with severe, acute right sided abdominal pain, fever, and persistent hypertension. A contrast enhanced CT scan revealed a massive right sided renal infarction. The peptide had triggered such intense localized renal artery vasoconstriction that it cut off the blood supply, completely destroying approximately 50% of his kidneys. He survived, but was left with permanently reduced renal function and a chronic need for long term blood pressure medications. Then there is this documented urological emergency case, refractory low flow priapism. Because melanocortin receptor activation directly drives central erectile pathways via nitric oxide mechanisms, unregulated dosages can induce a nightmare scenario. This is the case of a 41-year-old male injected a single vial of unregulated melanotan bought online and presented to a urology center with severe, painful, continuous penile erection lasting 22 hours. The blood inside the tissue was completely stagnant, fully depleted of oxygen, and highly acidotic. Essentially, the tissue was suffocating. Doctors had to perform a bilateral nerve block, manually aspirate 700 cc of ischemic blood directly out of the tissue, out of his penis, and deliver repeated serial injections of phenylephrine directly into the organ to force detumescence. At his 4-week follow up, the patient was left with severe persistent erectile dysfunction due to irreversible tissue fibrosis. Unregulated peptides can also cause severe skin and mucosal complications. A 65-year-old female with absolutely no prior history of autoimmune diseases injected online source melanotan and developed pyoderma gangrenosum. This is a horrific, sterile neutrophilic dermatosis. It looks like an infection, but it acts even worse. Within days, her abdominal injection sites rapidly degenerated into large, excruciatingly painful ulcers with necrotic centers. This condition is completely resistant to regular antibiotics. This required massive doses of systemic steroids that induced severe neuropsychiatric anxiety and insomnia, leaving her with permanent, extensive cribiform scarring across her abdomen. Another patient using Melanotan II for 64 days developed sudden permanent oral mucosal hyperpigmentation, leaving dark symmetrical brown macular bands permanently stained across their attached gingiva and gums. Let's move to growth hormone secretagogues and tissue repair peptides, very popular like Ipamorelin, GHRP2, and BPC 157. While heavily marketed in biohacking circles for injury recovery and fat loss, they present profound hidden oncological risks. Compounds like BPC 157 heal tissue by aggressively upregulating vascular endothelial growth factor or VEGF, alongside early growth response 1 and endothelial nitric oxide synthase. This triggers rapid angiogenesis, the building of new blood vessel networks. While that is beneficial for an acute sterile tendon injury, systemic administration of a powerful angiogenic stimulator is an extreme hazard if you have a dormant and diagnosed pre-malignancy or microtumor inside your body. Neoplastic tumor growth and rapid metastasis are entirely dependent on angiogenesis to secure a blood supply. By artificially forcing blood vessels proliferation and stimulating growth hormone axis, these gray market peptides can act as direct biological fuel, rapidly accelerating the growth of dormant cancer cells and sending quiet malignancies into invasive aggressive progression. Furthermore, look at the historical data on ipamorelin and DHRP2 in controlled peer-reviewed clinical trials investigating gastric paresis. Translating ipamorelin into human trials revealed catastrophic safety signals, including sudden death when administered IV to critically ill patients. This led to the immediate termination of all corporate drug development pipelines for those indications. Yet today, unaccredited online portals and gray market clinics routinely administer these exact secretagogues intravenously to healthy consumers under the false guise of total body rejuvenation. Even with mainstream approved molecules, the post marketing pharmacovigilance data reveals unexpected physiological signals. Take a look at the FDA Adverse Event Reporting System, or FIRES database analysis through Q1 2025, specifically tracking tirzepatide. Across a massive cohort of 67,305 individual adverse event reports, serious outcomes accounted for 9,266 cases. Out of those serious cases, 32.47% required acute inpatient hospitalization. 317 patients faced immediate life threatening events, and 288 deaths were officially recorded. The data also identified clear, unexpected reproductive and neurological signals. including acute postmenopausal hemorrhages, severe menstrual disorders, cases of anorexia nervosa, and even occurrences of Wernicke's encephalopathy due to profound thiamine and nutritional depletion from extreme unmonitored gastrointestinal stasis. Because the clinical and physical harms of these unapproved compounds have dramatically escalated, federal law enforcement agencies have officially transitioned away from civil administrative warnings and are now executing aggressive criminal prosecutions. The era of regulatory flexibility is completely over. Look at what happened on April 1st, 2026, in Salt Lake City, Utah. A federal grand jury returned a major criminal indictment against a 39-year-old licensed physician, Dr. Justin Bradley Watkins. A joint investigation by the FDA Office of Criminal Investigations and state licensing boards revealed that Dr. Watkins operated a massive fraud scheme. He was purchasing unapproved, non FDA certified bulk peptides directly from manufacturing laboratories in China via an illicit domestic middleman. The imported compounds including raw powders of tersapatide, semaglutide, BPC 157, TB 500, and Ipamorelin. Dr. Watkins bought these chemicals at deep discounts, fully aware that they had never undergone human safety testing or verified quality control. He and his staff then created and affixed completely fraudulent clinical labels to the vials, intentionally omitting the names of the Chinese factories to deceive patients and state regulators. He distributed these adulterated, misbranded drugs to over 200 clinical patients. He is currently facing severe federal prison sentences and massive financial penalties. At our ports of entry, the scale of this black market is massive. Between December 2024 and March 2025, U.S. Customs and Border Protection officers in Cincinnati intercepted a highly coordinated international smuggling operation originating from China. They seized over 300 cargo cartons containing approximately 5,000 individual shipments of unapproved, mislabeled GLP 1 receptor agonists. The criminal networks were deliberately mismanifesting these high potency drugs as unrelated consumer goods, dividing them into tiny parcels with individual residential labels to actively bypass border security. And the major online direct to consumer peptide giants are being systematically dismantled now. For a long time, these businesses believed that putting a research only use disclaimer on their website protected them legally. But federal prosecutors have established a definitive legal precedent. Those disclaimers are completely invalid when your underlying marketing, your consumer base, and your distribution of accessories like sterile water and insulin syringes prove that you are knowingly distributing drugs for human consumption. In June 2025, federal agents executed a coordinated armed raid on the warehouses of Amino Asylum, one of the largest direct to consumer peptide distributors in the country. Agents seized their entire physical inventory, digital infrastructures, and financial billing records. Their website went dark that same day, and their operations were permanently closed. Witnessing this escalation, Peptide Sciences, the long-standing giant of the online research peptide market, voluntarily pulled their entire product catalog offline and ceased operations overnight in March 2026 to mitigate imminent criminal exposure and prevent DOJ asset seizures. The DOJ also successfully prosecuted tailor made compounding for mass marketing unapproved peptides like BPC 157 without patient specific prescriptions, forcing a massive $1.79 million financial forfeiture. This is a global crisis. Europol recently executed the counterfeit network takedown, dismantling a massive international network that generated $278 million selling counterfeit medicines and unverified performance peptides, resulting in multiple arrests and the blocking of hundreds of illicit websites. Meanwhile, in Australia, the Therapeutic Goods Administration issued an urgent medical alert following a massive surge in emergency room hospitalizations. Australian emergency physicians are treating young patients presenting with acute myocardial infarctions, profound irreversible systemic hormonal dysregulation, and horrific necrotizing skin infections requiring extensive surgical debridement, skin grafts, or complete amputations due to using growth stimulating peptides manufactured in highly unsanitary, unverified backyard laboratories. So let's look at the absolute bottom line. What should you actually do with all of this information? The takeaway here is not that you should be terrified of peptides or avoid them altogether or say that they have no therapeutic value. The takeaway is that you must understand the stark reality of the supply chain right now. Because the FDA placed these compounds into Category 2, there is currently no compliant, legitimate mass scale standard compounding pharmacy in the United States that can legally mass produce unapproved peptides like BPC 157, Ipamorelin, or Melanotan II using pharmaceutical grade bulk drug substances. What does that mean for you as a consumer, as a patient? It means that if you're currently buying these substances online or through a clinic that source relabels research chemicals, you are almost certainly unverified raw materials sourced from foreign manufacturing plants with zero external quality controls, zero purity testing, and an established risk of endotoxin or chemical contamination or just impurities. Telling someone simply don't do it is paternalistic. And in my opinion, and in my professional career, it doesn't work. If you choose to navigate the frontier of peptide medicine, you need to do so with your eyes completely open, utilizing an active harm reduction model. In my opinion, the single most important step you can take is to bring your physician into the loop. Talk about it. Do not attempt to self prescribe or self administer gray market research chemicals based on forum guides or internet dosing protocols. You need an active, collaborating medical professional who can, number one, run comprehensive baseline diagnostics, including full cardiovascular evaluations and maybe even deep oncological screenings, ensuring you do not have a dormant malignancy or underlying vascular issue that these pathways could inadvertently accelerate. Second, meticulously evaluate your sourcing, helping you reject dangerous research use only compounds and navigate safe FDA approved pharmaceutical options where available. Three, correct complex dosing mathematics and select pre-filled non-modifiable delivery systems to completely eliminate the syringe calibration errors that are driving hundreds of patients into emergency departments. And four, continuously monitor your metabolic biomarkers. Follow up with your doctor. Ask for labs every 6 months, liver transaminases, renal functions, catching any sign of systemic strain long before they progress into an acute medical crisis. Listen, peptides are incredibly powerful biological molecules. Treat them with the exact same respect, clinical caution, and rigorous medical oversight as any other advanced pharmaceutical compound. Stay safe, stay educated, understand your sources, speak with your physician, try to do your own research, try to stay safe. Let me know your thoughts or experiences in the comments below.